Welcome back, everyone. An estimated 5 million Americans are living with AFib, which is an irregular and often very rapid heart rhythm. In just 5 years, though, that's projected to jump to more than 12 million people. All of this according to the American Heart Association. It's part of why it's trying to raise awareness about this condition after new research notes 62% of people with AFib had no prior knowledge of this condition before being diagnosed.
Here to help this morning shed some more light on what this is exactly is Dr. John Burkhardt, a cardiac electrophysiologist at Texas Cardiac Arrhythmia Institute. Dr. Burkhardt, thanks for joining us today. We appreciate it.
Thank you. Good morning.
We touched on it a few moments ago just a bit, but could you explain a little bit more to help people understand what AFib is exactly?
Certainly. AFib is a chaotic, irregular heart rhythm that originates from the top chambers of the heart. It is associated significantly with stroke, which is one of the reasons why it's so important.
And are there certain symptoms of this that people might want to be aware of that they might experience to kind of tip them off that they have this?
Yeah, most common symptom is palpitations, meaning that you feel your heartbeat is not regular. Other symptoms include difficulty getting your breath with exercise or shortness of breath at rest. So lung-related symptoms are fairly common, and fatigue is also very common. Occasionally dizziness and chest pain, even though those are somewhat less common.
Mm.
When do some of these symptoms become an emergency?
The emergency, certainly if you have severe symptoms. So if you feel like you're going to pass out, if you're unable to do any activity whatsoever, then certainly go to the emergency room. And then certainly any stroke type of symptoms of where you lose function in one side of your body, you lose your vision, anything like that would prompt an emergency room visit.
Dr. Burkhardt, how preventable is something like AFib?
Unfortunately, it's not incredibly preventable, but there are certainly things that can reduce your risks. And the major risks in the United States include obesity and sleep apnea. And so keeping your blood pressure under control, avoiding uh, excess weight, regular exercise, those are things that help reduce the risk.
Mm. You mentioned stroke earlier. Why is early detection and treatment of AFib so key, and how can detecting it early prevent some other conditions?
Yes, so early detection is key, certainly regarding stroke. And so if you have stroke risk factors and atrial fibrillation, it's very important to be on blood thinning medicine, which significantly reduces the risk of stroke. Also detecting it, particularly if your heart rate is very rapid for prolonged periods of time, that can actually damage the pumping function of the heart. And so the earlier you detect it, the more chances you have to prevent stroke and prevent decline in the pumping function of the heart.
Dr. Burkhardt, we mentioned a few moments ago some of the studies that showed that very few people are really aware of this kind of condition. Why do you think that is exactly?
I think sometimes it's difficult to figure out, and that some people don't have palpitations, and so they don't recognize that it's actually the atrial fibrillation that may be the cause of their shortness of breath, of their fatigue, etc. Also, it's not always persistent, and so AFib can be what we refer to as paroxysmal, meaning that it comes and goes, and so they may not recognize the periods where they're in atrial fibrillation if they're not checking regularly. And that's one of the things that we recommend is that you should certainly check your heart rhythm on a regular basis. People who check their blood pressure regularly, those machines will also tell you if your rhythm is regular. And currently, in the days of these smartwatches and things like that, those have automated detection algorithms for AFib. And certainly, if you have risk factors, we recommend turning those detection algorithms on.
Now, if someone maybe has noticed these symptoms or seen some of this on their Apple Watch or whatever it may be, where should people go to try to take that next step to really figure out if they are going to be diagnosed with this condition?
So what I would recommend is if your watch recognizes it, many of these wearables have the ability to take an EKG in addition. And so you download that to your phone. You can also email that to your doctor. But certainly if you are getting signs of atrial fibrillation, you should certainly start with your primary care doctor or go to a cardiologist or cardiac electrophysiologist for further evaluation and care.
Okay, that gives people some good next steps. But Dr. John Burkhardt, we'll leave our conversation there. Thanks again for being with us today.
Thank you.